Hello, New Bedford Public Schools staff, students, and community. I appreciate your time for the next few minutes so I can share where we are as we enter week 2 of phase 3 of our school reopening plan. I know anxiety remains high as we continue to live with the uncertainty of COVID-19. We're in this together as we all work to stay safe. I've shared our focus several times over the last few months, and I'll be willing to provide more details today. I do need to share that the challenges of COVID-19 are compounded with the inequities that many of our students and families face. 1 in 5 of our students have limited internet access, making the distance learning process a challenge. In over 9,000 families, almost 70% of our students have economic challenges and depend on our schools for meals with an increasing need for mental health support. We're working to completely address equity, so our students are getting what they need. It's an ongoing process. Given the numerous factors involved in monitoring, I hesitate to set a concrete number that will determine a shift to all distance learning. However, I will describe the data analysis and tracking we use to assess the impact on all schools and individual school communities regarding the average daily positivity and trajectory rate of the virus. Our processes and steps for keeping facilities disinfected have been clear, and they are being implemented effectively by our staff. Masks are required to be worn by all adults and students in all grades to assist in keeping everyone physically safe. We have improved ventilation in classrooms by purchasing over 600 portable air exchange units, along with ensuring that windows are functioning and doors are able to be taken care of as well. Guidance from the Centers for Disease Control, the CDC, and the Massachusetts Department of Elementary and Secondary Education, DESE, continues to be updated. This is all based on science and research of many doctors and infectious disease experts throughout the state and throughout the country. We continue to use their recommendations combined with the New Bedford Department of Health and local hospitals to inform our response to the virus trajectory and positivity rate. I know anxiety continues to be high as the city has remained in the state's red category for the last several weeks. But however, in recent weeks, the CDC has developed a metric table specifically for schools. It focuses on 3 core indicators, including data metrics for cases per 100,000 people, the average positivity rate, and if places are effectively implementing 5 safety precaution strategies, which consist of proper use of masks, physical distancing, hand hygiene, which is washing or using sanitizers, disinfecting locations, and the contact tracing process. Our schools are effectively implementing these protocols and are assessed for each school. So please visit the CDC website to see the indicators directly. Based on New Bedford's current 10 average of daily cases per 100,000, which is a 0.2 increase from last week, we are still in a lower risk transmission category for schools as defined by the CDC. And so far this school year, New Bedford has only had 1 positive case for students in our buildings. Our team participates in several meetings per week with city officials, local health experts, all reviewing and analyzing the New Bedford specific case numbers, their locations, and the contact tracing process. So just a reminder that a close contact is someone who has been within 6 feet of an infected person for more than 10 minutes. And this is within 2 days of the COVID-19 positive person showing symptoms or being tested, if asymptomatic. So again, based on the CDC guidance, we will continue to implement our hybrid plan as we currently have 15% of our 13,000 students in school buildings. My focus remains on keeping all staff and students safe and enforcing requirements for mask wearing and appropriate physical distancing, which is always at 6 feet. Our daily tracking of the virus data trends provides clear information regarding the necessity to shift from hybrid to a full distance learning if we see a pattern of positivity emerging. This means that we are currently averaging 10 positive cases over a 14-day period. So 10 people per 100,000 being positive, which still has us in the lower risk category for the CDC indicators. But another Critical factor is positive cases are showing as a spread throughout the community or in clusters. That's something that we're seeking to make sure that we have a handle on that if it begins to occur. So during the last few weeks, New Bedford has remained steady at an average of 9 to 10 cases per 14 days for 100,000 people. And information from this past Wednesday indicates no new cases for school-age children, which are ages 3 to 19. So the virus rate among school-age population remains very low. And overall total cases for all people from Wednesday increased by 6 per 100,000, which is lower than the 14-day average. So we're optimistic that the trend will start going in a decrease. To combat new cases and keep the rates for students low, parents, it is critical that all children and adults exhibiting any of the identified symptoms stay home. Also, if anyone in your house tests positive or is experiencing COVID-like symptoms, your child must remain at home as well. Please do not put others at risk by sending sick children to school or students who live with someone who is sick to school. So unfortunately, there will be cases that will exist in the city, but I'm confident that our precautions, our collaboration, making sure our schools are effectively implementing and our overall school community continues to be diligent. This is how we'll get ahead of this and stay ahead. We must focus on prevention, keeping our distance and wearing a mask when required. So again, physical safety is priority. However, as I previously stated, this pandemic has illuminated the socio-emotional challenges that many of our students and some of our adults are experiencing. It's created by isolation, and there are many changes in some of our home environments. So this is compounded by the fact that more than 5,300 of our 41% of our families are challenged by language barriers as English is not their first language. So you have to be mindful of that. I hope that I was able to provide more clarity on how we're working to safely provide a safe environment for our students and staff. So thank you for your continued support and contact your school with any questions. We continue to work with several other districts and cities across the state to ensure that we're getting out in front and staying out in front so we could keep the virus transmission rate low to 0. So again, look at our website, call us at our family support line at 508-997-4515. We're working to keep families up to date, and your understanding is appreciated as we work through this together. So please think of others, keep your distance, and please wear your mask. Thank you.